Good morning. So in today's lecture, we are going to continue with the other category of antimicrobial agents, specifically the antibacterial agents. As you all know, in the last lectures, we had discussed about the introduction to antibiotics, and then we had seen about two categories of antibiotics, the beta-lactam antibiotics and the macrolide antibiotics. Now in today's lecture, we are going to see another categories of antibiotics. So in the first lecture, we are going to study about sulfonamides, cotrimoxazole and fluoroquinolones. So we are going to see what are the mechanism of action of these category of medications, what are their uses, what are their classifications, etc. So coming to the first type, that is the sulfonamides. So sulfonamides were first used for treating pyrogenic bacterial infections. Pyrogenic bacterial infections. Pyrogenic means those things that produce fever. So in such cases, the sulfonamides were the first newly used agents which were used for the treatment of pyrogenic bacterial infection. Now, they are bacteriostatic against many gram-positive and gram-negative bacteria. But the problem is their use is now limited because of the development of bacterial resistance. So if sulfonamides are used alone, they have the problem of bacterial resistance. That means the bacteria are resistant to the sulfonamides. But if they are used in combinations, then they can produce good effect against the bacteria. So what are the combinations? If sulfonamide is combined with trimethoprim, it is named as cotrimoxazole. So we are going to see in the future slides what is the use of cotrimoxazole. Sulfonamide, if combined with another medication, that is pyrimethamine, it can be used for the treatment of malaria. So sulfonamides as such alone can be used for treatment of different conditions, but the bacteria easily develops resistance. So that is why they are preferred to be combined with other antibacterial agents in order to avoid the development of bacterial resistance. Now coming to the classification, depending upon the how much time they, depending upon the half-lives, you can say, they are classified into short acting, intermediate acting and long acting sulfonamides. Short acting means their action is about 4 to 8 hours. They are rapidly absorbed and rapidly excreted. Intermediate acting, their action is about 8 to 12 hours. That means they are relatively slowly absorbed and slowly excreted. Long acting sulfonamides, they can show their action for more than 1 week. So this is about the classification. Depending upon their half-lives, they are classified into short acting, intermediate acting and long acting. Now we are telling that they are the drugs which are having bacteriostatic action. Now how are they producing this action? What is the mechanism by which these sulfonamides are able to have a bacteriostatic action? So these sulfonamides basically target an enzyme which is known as folic acid synthetase. This enzyme, folic acid synthetase, is responsible for the formation of folic acid, and because of this inhibition of enzyme, it leads to the deficiency of folic acid and ultimately causes injury to the bacterial cell. Now, why is folic acid so important in the bacteria? If folic acid is not there, it is leading to injury to the bacterial cell. So, folic acid is important for the synthesis of DNA in the bacteria. We are talking about the mechanism of action of sulfonamides in the bacteria. So in the bacteria, they are inhibiting the enzyme folic acid synthetase. So what will happen if this enzyme is inhibited? It will lead to the deficiency of folic acid. Folic acid will not be produced, thereby leading to a disruption or destruction of the bacterial cell. So we can understand that folic acid is necessary for the synthesis of DNA. So due to this deficiency, what is happening? The bacteria is not able to grow, or the bacteria is not able to multiply. And these sulfonamides can cross the blood-brain barrier, and also they can cross the placental barrier. Coming to the uses, they are basically used in the UTI infections, that is urinary tract infections, respiratory infections, sinusitis, bronchitis, pneumonia, all infections related to the respiratory system. Sulfoxazole and sulfamethoxazole are used in these conditions, whereas the second important drug, that is sulfasalazine, is used in arthritis and ulcerative colitis. The third example is sulfur sulfadiazine. Now this drug is used basically in the dressing of burns. So it is a topical medication which can be used for burns. And the oral medication can be used in the treatment of meningitis, especially in people who have a maxillofacial trauma, who suffer with a maxillofacial trauma. So that were the uses of sulfonamides. The most important uses are, it is divided into categories. Sulfoxazole and methoxazole are used for UTI and upper respiratory tract infections, including pneumonia and bronchitis. Sulfasalazine, it is used in arthritis and ulcerative colitis. Silver sulfadiazine is used in burn dressing and meningitis. Coming to the adverse effects. So simple adverse effects, nausea, vomiting, epigastric pain, rashes is seen. Apart from that, Stevens-Johnson syndrome is also seen with sulfonamide. So this is usually seen in people who are hypersensitive. So in such type of people, a skin rash or a skin disease occurs. Not a disease, but it will heal quickly. So it first starts with flu-like symptoms, and then it flares up into a rash-like thing, red or purple colored rash, which spreads, and then it forms small blisters. And then after that, what happens? It heals. The dead skin, it just sheds away, and then it heals. So this type of syndrome is usually seen with the long-acting sulfonamides. So Stevens-Johnson syndrome is usually seen with the long-acting sulfonamides. Now, as I told you, if they are used individually, resistance will develop. So most of the bacteria, they are capable of developing resistance to the sulfonamide. And if one category of sulfonamide becomes resistant, I mean if the bacteria is resistant to one category of sulfonamide, it can develop resistance to other category of sulfonamides also. That is why their use is now limited, although they are used in combinations. So it is combined with trimethoprim, as I told you, a fixed combination of trimethoprim and sulfonamide. Which sulfonamide? The intermediate acting sulfonamide, that is sulfamethoxazole. This combination is known as Cotrimoxazole. And this Cotrimoxazole is used for many different conditions, such as it is used for UTI and diarrheas and sinusitis, tonsillitis, etc. So this is the combination of trimethoprim and sulfonamide. Within the sulfonamide, it is combined with the intermediate acting sulfonamide, that is sulfamethoxazole. So we will first see about trimethoprim individually, then we will see about the combination of trimethoprim with sulfonamide. So individually, trimethoprim also blocks the synthesis of DNA, same like sulfonamide, but it inhibits another enzyme, that is bacterial dihydrofolate reductase enzyme. Now, what is the importance of this enzyme? This enzyme is also responsible for the bacteria to grow and multiply, right? How will the bacteria grow and multiply? With the help of replication of the DNA. So here also it is blocking the synthesis of DNA. It is inhibiting. How is it blocking the synthesis of DNA? By inhibiting the enzyme. When this enzyme is inhibited, the synthesis of DNA will be inhibited. Ultimately, the bacteria will not be able to grow and multiply. It is used in the treatment of UTI, and some of the dangerous adverse effects are it might cause megaloblastic anemia and leukopenia. You know what is megaloblastic anemia? The RBCs, they become large in size, megaloblastic anemia, and leukopenia means decrease in the number of white blood cells. Now this condition can be prevented by simultaneous administration of folic acid. That means this drug is also causing a reduction in the normal levels of folic acid of the human body, thereby causing this anemia. So in order to avoid this adverse effect, simultaneous administration of folic acid can be given to the patient. Now we are going to see the combination of trimethoprim and sulfamethoxazole, that is cotrimoxazole. So cotrimoxazole is a combination, as I told you. What is the importance of this combination? When these two drugs are combined, it will lead to a good activity, enhancement of activity of both the drugs. If both synergistic action, you can say. So trimethoprim and sulfamethoxazole together, if they are given, it leads to a synergistic effect, and that medication is known as cotrimoxazole. Also, if they are given individually, trimethoprim individually is bacteriostatic, sulfamethoxazole individually is bacteriostatic. But when both of them are combined together, they become bactericidal. That medication becomes bactericidal. That means cotrimoxazole is bactericidal against many organisms. And this medication is also used in the treatment of UTI, tonsillitis, sinusitis, bronchitis, pharyngitis, so respiratory tract infections, and it is also used in diarrheas and dysentery, many cases of diarrheas and dysentery. Because this is a combination, resistance will develop very slowly. It is not very easy for the bacteria to develop resistance because this is a combination of two drugs. However, adverse effects such as nausea, vomiting, rashes can be seen, and cotrimoxazole is contraindicated in pregnancy. So this is about the sulfonamides, trimethoprim, and then combination of sulfonamide and trimethoprim, that is cotrimoxazole. The next category of antibacterial agent is quinolones. Quinolones are basically effective against gram-negative bacteria. However, there are many generations of quinolones. Among them, the second generation quinolones are the fluoroquinolones. Now, these fluoroquinolones are effective against gram-positive as well as gram-negative bacteria. So, as I told you earlier also, how the drugs are being discovered or how the drugs are being synthesized, the latest generations will have more efficacy and less side effects. So here also, earlier only quinolones were effective against gram-negative bacteria, but the second generation quinolones, that are the fluoroquinolones, are effective against both gram-positive as well as gram-negative bacteria. Now coming to the mechanism of action of fluoroquinolones. Now these fluoroquinolones also attack the bacterial DNA synthesis. So they also block the bacterial DNA synthesis, but they inhibit another enzyme. Now, bacterial DNA synthesis is not a one-step process. It will have many different steps involving many different enzymes. So these drugs, they are blocking different enzymes, ultimately leading to the inhibition of the synthesis of DNA in the bacteria. So here the fluoroquinolones are inhibiting the enzymes topoisomerase 2 and topoisomerase 4. So topoisomerase 2 is inhibited in gram-negative bacteria and topoisomerase 4 is inhibited in gram-positive bacteria. However, they are well tolerated and resistance is there for fluoroquinolones also. How is the resistance? What is the mechanism by which the bacteria is developing resistance? The first is due to reduced permeability. That means the bacteria is not allowing the drug to come inside. If the drug manages to come inside, then it will cause efflux of the drug. We have studied the mechanisms of resistance in the introductory class of antibiotics, right? So within that we had the mechanisms, that is reduced permeability. That means the drug is not allowed to enter inside. And if the drug enters inside, they have specialized pumps to throw the blood, not the blood, the drug. The drug is not allowed inside at first. But if the drug manages to enter inside the bacteria, then the bacteria develops specialized pumps which throws the drug outside. That is known as efflux. So this is the mechanism by which the bacteria tries to develop the resistance to fluoroquinolones. Coming to the adverse effects, simple adverse effects are seen, that is nausea, vomiting, headache, skin rash, etc. But trovafloxacin, one type of fluoroquinolones, it shows abnormal liver function test, and this medication is also contraindicated in pregnancy. Examples include ciprofloxacin, norfloxacin, ofloxacin, levofloxacin. These are the examples of fluoroquinolones. So once you see floxacin, you should identify it is a fluoroquinolone. Now, among these medications, you might have heard a lot about ciprofloxacin. Now, this ciprofloxacin is, prescribed for many bacterial infection, even if we do not know what is the bacteria. So this medication is prescribed very frequently for bacterial infections, but it should not be prescribed for any minor infections. Okay, coming to the uses, it is used in UTI, gastroenteritis, septicemia, otitis media, ocular infections, eye infections, ear infections, septicemia, typhoid fever, gastroenteritis and UTI. So we were discussing about ciprofloxacin. Now this ciprofloxacin, I told you, it is a very important fluoroquinolone. It belongs to the first generation of fluoroquinolone. It is having bactericidal activity. However, if it is taken together with food, its absorption will be delayed. Safety is good, side effects are rare, and because it is a broad spectrum antibiotic, it is used in as a blind therapy to any infection because it is able to kill most of the bacteria, broad spectrum antibiotic. So it is used as a blind therapy to any kind of infections. However, it should not be used for minor cases. Sometimes it is combined with metronidazole to treat infections such as periodontitis. So this is about the 3 different antibacterial agents, the fluoroquinolones, the Cotrimoxazole, that is trimethoprim, and the Sulfonamides. So I hope it is clear for all of you. Sulfonamides, Cotrimoxazole, and fluoroquinolones. So this is the first lecture. In the next lecture, we are going to see about the another category of drugs, that is the tetracyclines and the chloramphenicol.